The reason why we want to be here today is to focus on several concepts about PPE. First is to make clear that we achieved one of our top priorities during the course of this pandemic, and that was to ensure adequate supply of PPE to everyone in the state of Texas that would need it. But second, one reason why we're here today is that there are two coming events that will put an even greater strain on the need for PPE supplies. One is the coming opening of schools in the state of Texas. The other, as we go down the calendar, is the coming flu season, where in addition to people who are testing positive for COVID-19 and taking tests of people whether or not they do or do not have COVID-19, there will be the need for PPE supplies to also help people deal with flu season. Well, I want everyone to know that because of the incredible efforts by these teams to make sure that they were able to set up the supply chain to have adequate inputs of supplies from across the entire globe, we have abundant supplies to make sure that we will be able to continue to provide PPE to schools, to hospitals, to nursing homes, to testing sites, to any operation in the state of Texas that is going to need PPE in response to the pandemic. Let me share with you some numbers about exactly what Chief Kidd, TDM, the Texas Division of Emergency Management, as well as the Supply Chain Task Force have been able to achieve. As of today, TDM has distributed more than 130 million masks, more than 33 million gloves, more than 7 million gowns, and more than 4 million face shields. Now, you can tell perhaps by your observation that they have not been doing this alone. They have teams working with them to help execute this, and key members of those teams include the National Guard that we have here in the state of Texas. We're very grateful for the role the National Guard has played, and I'm very proud to announce something that was released late last night, and that is the President has reauthorized and extended federal funding for National Guard to continue in service through the remainder of this calendar year at a 100% reimbursement rate. That is a tremendous financial as well as personnel assistance to the very robust response by the state of Texas to COVID-19. Now, I mentioned that one of the things that we are focused on with regard to PPE, as well as focused on with regard to the state, is the beginning of the school year. I want to give you a couple of comments about the school year and then mention a little bit more about PPE related to it. As the school year begins, the several things must be known, and that is working with the TEA, the Texas Education Agency, and working with local school districts. We all agreed that there needed to be one overriding principle as we open schools this year, and that is putting the public health and safety of students, teachers, parents, and everybody connected with the school the absolute top priority. And the second, in order to achieve that priority, was the necessity to build in a level of flexibility for schools this year to be able to achieve the goal of the health and safety of students and teachers. And what that means is this. It means, first, that every school district in the state of Texas has the option to choose what is the best date for them to begin their school year. Some school districts are choosing to begin their school year this month in the month of August. Others are choosing to begin their school year in the month of September, and they could even choose different dates than those. Then, when they decide to go back to school, school districts are empowered to decide how they are going to open. If they choose, they can open their schools with in-classroom learning, or if they choose, they can open schools with remote learning through online strategies, or if they choose, they can have a blend of both classroom setting as well as online learning. The bottom line is the people who know best about what both the needs are in their school district, as well as the capabilities of providing a safe learning environment, the people who know best about that are the local school officials. Extremely important. Local school officials have access to information provided to them by local public health authorities. And local school districts can base their decisions about when and how to open their schools on the advice of those local public health authorities. Equally important, when the school year begins, you see that flexibility component really kick in. Because as the school year begins, it may turn out for many schools, they will begin the school year having education provided only in a remote way. And that remote strategy of delivering education can continue for up to 8 weeks, continued remote only, if that is the safest setting, or even maybe the only setting that education can be provided for their students. And then after that 8-week time period, schools also have the option of seeking a waiver from the Texas Education Agency to meet the unique needs of a particular school district, understanding this very common concept about education in Texas. What may apply to one school district in one region in the state of Texas could be completely different from what may apply to a different school district in a different region of the state of Texas. And hence, there will be the local flexibility so that local school districts will be able to meet the education needs of their students, of their parents, and of their teachers, making sure that they will be able to prioritize safety as well as be able to prioritize the advancement of education. Now, one thing that we've all learned during the course of this pandemic is the ongoing need to remain flexible. And that ongoing level of flexibility is continued through the education process in two very important ways. Whatever date local schools decide to begin the school year with in-classroom education, there may be times that arise when a student or a teacher, somebody else in a school, contracts COVID-19. If that is the case, the school does have the option of being able to shut down that school for a period of days to make sure they're able to sanitize the school, return safety to the school, while also providing remote education to students. And then on top of that, during the course of a school year, just as we've seen in school years past, local public health authorities do have the ability to make recommendations that either a particular school or a particular school district should close their doors for a period of time in order to remedy what may be an outbreak of whatever kind that may be occurring in that school. So this is a long list of strategies that shows that there is a tremendous amount of flexibility to make sure that schools, teachers, and students, as well as parents, are going to have both the flexibility that they need as well as the safety they need to make sure that students will be able to be educated. Now, on top of that, the state of Texas wanted to make sure that we were providing schools with the PPE supplies they need as the school year begins. And so let me tell you what Texas has already distributed to schools in the state of Texas. Already, the Texas Division of Emergency Management has provided Texas schools with more than 59 million masks, more than 24,000 thermometers, more than 565,000 gallons of hand sanitizer, and more than 500,000 face shields. And that's just as of right now. As you can see what's going on behind us right now, there continue to be new deliveries as we speak on an ongoing basis to make sure that all of the PPE supplies of all of the schools across the state of Texas will have their needs met at no cost to the local schools, because this is being paid for by the state of Texas to ease the financial burdens of the local school districts. Now, to tell you more about how this operation works and what is being done both with regard to PPE as well as responding to the needs of our fellow Texans is Chief Nim Kidd, the Chief of the Texas Division of Emergency Management.
Thank you, Governor. And good morning. I apologize for the temperature in the warehouse, but I hope that you'll have a great appreciation for the men and women behind us that have been working here for about 135 days around the clock a little over 3,000 hours logged by over 200 employees, family members, participants, our friends from the Texas A&M Forest Service, A&M AgriLife, A&M Engineering Extension Service, and the biggest component, the Texas Military Department. And Governor, as you said, the great thanks to our federal partners for keeping them here through the end of the year. This is one of 40 warehouses that TDM is partnering across the state. Now, this is the largest. This is our central one. Things that come in here go out statewide, but there are 39 other locations, as you can see on the map here to my right, that show all of the locations and the amount of PPE that is currently in inventory. And this is not a static number. This is a very dynamic number. We have ordered just over $1 billion worth of PPE. A little over 600 million of it has been received, and most of that has been paid for. Some of that, we've got the invoices and we're paying out. Another 400 million is still on order, and we expect to have it delivered within the next 60 days. So our goal is to get PPE out in the widest reaches of the state that we can. Every school district, every hospital, every nursing home assisted living facility, all fire and EMS first responder agencies. Now, on one hand, the national and global supply chain is coming back up. So we're seeing our normal partners use their normal distribution methods in receiving of PPE. This will turn into a stockpile for any future events, as the governor talked about. I think most importantly that I want to get out is thanks to the supply chain task force that Governor mentioned earlier. They really helped us in a critical time of need of going and finding PPE from all corners of the world when there was a shortage. But because of that and the connections that we've made, we are very rich right now in our inventory of PPE, and Governor, we stand ready to serve.
Thank you, Tim. Last thing, and then we'll take a few questions, is that just to make sure you understand, everything you see behind us, all of it is PPE, and all of it is going to be distributed across this region as well as other parts of the state of Texas. There's no other stock item in this warehouse other than PPE that Texas is distributing across the state. With that, we'll be happy to take a few questions. If I'm going to need you to speak up a little bit. It's kind of loud. You may feel free to. Sure. Well, we made clear when I say we, I mean myself, the Lieutenant Governor, the Speaker, as well as the Chair of both the House and Senate Public Education Committee, what the standard is in the state of Texas. And the standard is what it has always been, and that is decisions about school openings are made by local school boards and the superintendents they hire. And that standard has not changed. Now, what is also clear is that, as always, local school boards, they operate and can make decisions based upon input from local public health authorities. And so they, being the local school districts, are free to make decisions based upon local public health authorities. However, as it concerns when the schools open, they're not bound by any date dictated months in advance by a local public health authority. In my opinion, we have, by the joint release that was issued by myself as well as the Lieutenant Governor, the Speaker, and the chairs of the House and Senate Public Education. If they want me to issue an executive order, I can cut and paste what we issued and sign it. If they just show up with a copy of it, I'll be happy to sign it. Yeah, would you repeat the first part of your question first?
Would you actually read a letter that are signed by mayors that are sent to you asking you for, certain things? And the second one is, who will the mayor? Health departments or school boards when it comes to a decision if it has public letters?
Sure. For one, I do read the letters. Two, who prevails is going to be the local school districts that will prevail in the decision-making process, but it's very important to understand that there are ways during the course of a school year that local public health authorities have a very important role to play. Last year, before the COVID-19 pandemic ever occurred, there were some schools that were shut down because of the flu. Other schools may have other local public health orders, explain reasons why a school may need to shut down. That process always occurs. I will want to go back and answer both your question, but also make sure you understand something that I think that the local officials may not know. And that is, as we made clear both in the letter that I issued, but also in the Attorney General's opinion, if you go back to my earlier executive orders, preempted the effectiveness of local public health orders. And hence, I think the reality is the local public health orders that were issued by Bexar County, for example, were already preempted by my pre-existing executive orders, as well as what I explained both in my letter, but also explained in my prior executive orders, and that is exempt from any other type of local order are public facilities, which would include public schools. So very important, this is not my decision, and no one is having to place trust or non-trust in me. Very important, the decision is made by local school boards and superintendents. Equally important, local school boards and superintendents can base their decision solely upon the information provided to them by local public health authorities. Is that a question? Well, the way Texas law is set up is there are people who are chosen to make decisions for schools and how schools are to operate, and those are the local school boards. Again, to be perfectly clear, a local school board can choose to make their decision based upon what the local public health authority says. Nothing is stopping them from doing that, and they can fully adopt whatever strategy the local public health authority says. I do want to go back and make one thing perfectly clear, and that is, if you look at the letter that was issued by the local public health authority in Bexar County, the local public health authority suggested that schools should not open up for in-classroom education until September the 7th. If you go back to what was said in the letter that was issued by the state, which was just advancing exactly what the Texas Education Agency said, the Texas Education Agency said that schools have way beyond September the 7th before they have to open up for in-classroom education. They have 8 weeks after the first day of class. The first day of class can be September the 7th if that is when schools and school boards decide for the first day of class to be, and then after that they have 8 more weeks where they can provide education solely by remote education that puts the first day of classroom education not on September the 7th, which is what is allowed by the local public health authority here in Bexar County, but it would actually put it in the November time frame. And hence, it really is the responsibility and the necessity of the locally elected school boards that are responsive to the teachers, to the parents, to the students, to the public, to make the decision that is best for their school, understanding that what may be right for one school is completely different for another school. So part of this is being paid for by the CARES Act. Part of it through some of the personnel is being paid for directly by the federal government through Title 32 that's paying for all the National Guard. And through the executive order issued by the President last night, the National Guard is being able to be extended through the remainder of this calendar year, being paid for 100% by the federal government. Very importantly, with regard to the second part of your question, decisions about how the CARES Act funding is to be distributed is made by a committee of leaders in the legislature. So it involved people from the governor's office, it involved the lieutenant governor, the speaker, as well as the chair and vice chair of Senate Finance and House Appropriations. Collectively, they came up with a strategy about how the money is to be distributed across the state of Texas, and they will be the ones making the decision about how the state of Texas itself will be spending the money that the state has to spend on it. I think, as you know, as everyone needs to know, that money must be spent before the end of this calendar year. Say it again. My perception is yes, it should be subject to being available to the public. Let's talk about deaths, for example. One reason why there's a difference in numbers on deaths is because what the state has decided to do to ensure the highest level of accuracy for deaths is to use death certificates and then base it upon whether or not COVID-19 was listed as the cause of death, whereas otherwise there were two things that were going on. One, you may not have that same level of accuracy. Two, there were delays in getting that information to DSHS. Understand this, the way that the law is structured and works is DSHS that has the responsibility to provide that information to the CDC up the food chain. And so DSHS, that's the Department of State Health Services, sets the standards for how information is to be gathered and reported, trying to achieve the highest level of accuracy. Actually, you need to understand the way the federal government is setting up the standard for an antigen test. They are not counting antigen test as a positive the same way that they do a COVID-19 test. They're listing it as a probable. And so it's very important to separate the two because a COVID-19 test has a higher level of accuracy than does an antigen test. And hence, they will be categorized and reported separately.
Thanks, guys. We gotta go. Appreciate it.
All right, Governor Greg Abbott there from San Antonio, putting his mask back on as he ends this press conference. Spent the majority of the question and answer period here just kind of restating his position that it will be local school districts, that's school boards and superintendents, they will be the ones who decide when and how an individual district reopens across the state of Texas. It won't be a public health authority or a county judge, as we've seen attempted here in Harris County, with the county judge saying schools couldn't open until after Labor Day. The governor saying that local school districts can rely on their public health authorities, but they get to make the final decision because he says they know best. The reason he was here today at the state's main warehouse is to tour it, see all that PPE that is back there in those boxes you're looking at right now. Actually, we're looking at a graphic here. I'm looking at a different picture, but you saw all those boxes there behind him. That's masks and the type of stuff you need and in hospitals, in doctors' offices, at testing sites, and in schools. And we also heard that the state has ordered $1 billion in PPE and $600 million already delivered. We're talking about 59 million masks, 565,000 gallons of hand sanitizer, and 500,000 face shields, all already delivered to school districts paid for by the state so they can be ready whenever they decide to reopen this year. School districts can remain online for up to 8 weeks after their start date, and then they would have to get a waiver from the state to continue online only after that. But the governor making it clear it won't be local politicians, county judges, and mayors who decide when schools reopen. It'll be school districts, the school boards, and superintendents making those decisions. More to be told on that story, I'm sure, as there are some differing opinions on that. If you want to keep up to date at any time, and we will send an alert right to your phone when these press conferences happen. If you're interested in watching them live, you can download our KHOU mobile app, turn on the push alerts, and you can get those right to your phone, and you don't miss a thing doing it that way. Don't miss the news at noon, coming up here in exactly 1/2 hour with Sherman Chow. Hope you can join us then. I'm Russ Lewis. We will see you soon.
It does relinquish custody. You're a doctor. You work long, unpredictable hours. You'll be unmarried. The judge is going to want to know who's going to take care of this child.
There are lots of single parents out there.
That's true.